I'm Dr. Jake Irwin, physical therapist and owner of Pro Performance Therapy. I often get asked about a very specific tool that many physical therapists use. Matter of fact, not just get asked about it, but over the last 2-3 years, every time I tell somebody that I'm a physical therapist, the first words out of their mouth are, "Oh, do you do dry needling?" So we decided to talk a little bit about what dry needling is, what it isn't, and when it's appropriate. So dry needling is simply just inserting a needle, an acupuncture needle, into the skin in order to effect change. The difference between what we do as a physical therapist and what an acupuncturist does is that an acupuncturist is doing it in order to clear your chakras and align your meridians with the meridians of the cosmos. And to be completely honest, I don't know how to do that. So when a physical therapist applies a needle or uses a needle to effect change, it's for 3 reasons. There are 3 physiologic effects of sticking a needle through your skin. One is a local increase in blood flow, there's a local decrease in muscle tension, and there's an endorphin release in your brain. The interesting thing about dry needling is that you can get the first 2 effects, those local effects, without penetrating the skin. So you can literally, and there was a study done this way, where they literally just used a toothpick and poked the person's skin, and they still got the local increase in blood flow and a local decrease in muscle tension. The reason I point that out is that dry needling is not an end-all be-all cure of anything. And you can get the exact same effects of dry needling with lots of other techniques. So it's not a necessary treatment option for most PT-related problems, most orthopedic-related problems. It's nice, it's quicker sometimes, but it's not always necessary. And then there's the other thing with dry needling is that there's 2 major schools of thought in physical therapy dry needling. One is that you have to be doing trigger point dry needling, or basically sticking it into a muscle and aggressively pistoning the needle in order to effect change. And the other is a far more conservative approach where you can apply a couple needles superficially, go a little deeper, add a few more, add some e-stim to them until you get the change that you're looking for. Obviously, by the way you heard me talk about them, I prescribe more to that first line of thinking. So if you're going someplace and they're needling you aggressively, or they say that needling is necessary in order for you to achieve your goals, and you don't want to be needled, find another place to go. It's an appropriate treatment some of the time. It doesn't cure anything. It is not a long-term benefit. You shouldn't have it done every time you go to a PT. It shouldn't be done for every pathology. There are some pathologies for which it's more effective than other things, but really few and far between. So it's not something that should be done for every visit, every time, for every pathology. So if you don't like it, try another approach or try another therapist. The other thing you need to know about dry needling in the state of Georgia is that it is not legal to perform dry needling without a referral from a physician that specifically says for the PT to perform dry needling. So if you're going to your local gym and you've got a PT there who says, "Oh, if you've got a cool problem, I'll needle you really quickly," they are 100% breaking the law in the state of Georgia. So be wary of that. If your referral does not list dry needling on it, the physical therapist should not be needling you. If they'd like to needle you and you want to be needled, then you need to get a referral that says dry needling on it. So that's dry needling in the state of Georgia in a nutshell. I hope that's helpful to some of you. Hope you have a nice day. You can always reach us at properformancetherapy.com for any of your physical therapy needs.